Signs and symptoms of diabetes type 1 and what to do. We're all familiar with diabetes. However, there isn't one but two types of this condition. Type 1 diabetes is also known as insulin-dependent diabetes or juvenile diabetes. It is a chronic condition in which the body's immune system mistakenly destroys the insulin-producing cells in the pancreas. These cells are called islets of Langerhans. Insulin is a unique hormone that maintains blood glucose levels by signaling the cells to take it in. The glucose is used for energy purposes. If your body has enough energy, insulin signals the liver to convert excess glucose into glycogen and store it. The exact cause of diabetes type 1 isn't known. However, genes and environmental factors may be amongst the possible causes. Increased thirst may be one of the initial signs that you have diabetes. In diabetes, the blood glucose levels are usually high. Your kidneys are forced to put in extra effort work to absorb and filter the extra sugar. However, once they reach their maximum capacity, the excess sugar is excreted through the urine. This also drags out fluids from your tissues, leaving you dehydrated. As a result, you have to urinate frequently and feel thirsty as well. The signs and symptoms of diabetes can be sudden. Bedwetting is an early manifestation of type 1 diabetes in children who didn't wet the bed earlier during the night. The increased blood sugar and frequent urination may cause urinary urgency. Additionally, excess blood glucose damages your nerves. Due to nerve damage, voiding sensations are diminished and can lead to overfilling of urine in the bladder. This may result in dribbling and bedwetting. People with type 1 diabetes experience extreme hunger despite having regular eating schedules. The reason is that cells' inability to take up glucose due to the lack of insulin keeps them deprived of energy. Whatever food you eat is not converted into energy, making your body crave it. This results in a pang of increased hunger and a lack of satiety. Type 1 diabetes may lead to unintended weight loss, as most sugars in your blood and body are not utilized by cells. Instead, they're excreted out of the body through urine. This causes weight loss, even if your appetite is increased. Furthermore, without glucose to provide energy, your body starts burning fat and muscle to fulfill its energy requirements, leading to an unhealthy loss of muscle mass in your body. The alternating blood sugar levels affect your mood and can cause anger, irritability, and sadness. Sudden mood swings may occur due to a drop in blood sugar, and you experience irritation or confusion. Once the blood sugar levels set back to normal, these mood changes may resolve themselves. Diabetes may also cause mental health problems like anxiety, depression, and stress. These are collectively known as diabetes distress. Fatigue and weakness are common symptoms in people with diabetes. Your body requires energy to perform functions and everyday activities. The glucose in the blood is responsible for providing energy to the body cells. In diabetes, your cells cannot utilize the blood sugar, and their energy demands are not met. Therefore, you feel tired and weak. Blurred vision is also one of the symptoms of diabetes. It usually occurs when your diabetic condition is not under control. When the sugar levels in your blood remain unusually high for long periods, they pull in water into the lens and cause swelling. As a result, you're unable to view things clearly, and your vision gets blurred. This symptom does not resolve quickly after the blood sugar levels go down. Instead, it takes around 6 weeks for the swelling to resolve completely. If you feel tingling and numbness or burning pain in your peripheries, these may be peripheral neuropathy symptoms caused by diabetes. The high blood glucose levels injure your nerves and affect their ability to send and receive signals. Excess blood sugar also weakens the walls of your blood vessels. Damage to the blood supply of the nerves may also result in peripheral neuropathy. To diagnose type 1 diabetes, your doctor usually conducts a series of blood tests to determine your blood sugar levels in the past few months. These tests are performed at random times and during fasting. If the presence of diabetes is confirmed, the next step is to identify its type. For this, your doctor may perform additional blood tests to check for autoantibodies. Type 1 diabetes is an autoimmune illness, so the presence of autoantibodies in your blood confirms its diagnosis. Ketones are the byproducts of fat breakdown, so the presence of ketones in your urine also indicates type 1 diabetes. Once an accurate diagnosis has been made, you'll have to pay regular visits to your doctor. During these visits, your doctor will perform glycated hemoglobin tests to ensure that the treatment plan effectively works. Additionally, your doctor may also take a urine sample to assess your liver, kidney, and thyroid function. The main treatment options for type 1 diabetes include insulin intake, following a healthy diet, staying active, and maintaining a healthy weight. The treatment's main aim is to keep your blood sugar levels in normal or close to normal ranges. Your sugar levels before meals should lie between 80 and 130 milligrams per deciliter, and after meal sugar levels should be under 180 milligrams per deciliter. Dietitians usually recommend incorporating healthy foods like fruits, vegetables, and whole grains into your diet. Try to avoid animal products, processed foods, and refined carbs. Following a proper diet plan ensures that you are getting enough nutrients without risking your health. Physical activity benefits all, and people with diabetes type 1 are no exception. Both adults and children can benefit from aerobic exercises. However, make sure that your diet and medication doses compensate for this activity, as exercise lowers blood sugar. For diabetes-related distress and emotional disturbance, don't hesitate to seek support from professional therapists. You can also join online and in-person support groups.